My name's Dr. Choa. I'm an emergency room physician. I'm also a postpartum physician in Atlanta, Georgia. I advocate for moms. I advocate for my friends and my patients. This has literally become something that I just love doing. And me and Carine have known each other for over 20 years. We did a podcast together, Hey Doc, Let's Chat. We're both moms. We have a friendship that spans, many years. And so Carine, you can kind of go in and introduce yourself and who you are, and a little bit about yourself, and then we'll just talk about what happened to you.
Sorry, I'm still trying to fix my screen. It's my first time going live. Actually, my second time. But yeah, I am Dr. Carine, and I'm an OBGYN with a passion for women's health and wellness, based out of the suburbs of Philadelphia.
Yeah, and Carine has a wellness practice called Sibel. You didn't even say that.
Yes, I guess I'm logged in through CBEL. Um, as a mean to connect, with you today.
Yeah. So we're gonna keep it short. And so the reason we come on here is to just talk about something that happened to you a couple weeks ago. And basically it caught us both off guard because never would we have thought that, number one, you would be having symptoms of a stroke at your age. And then not only that, but you would have to encounter the level of discrimination that you encountered during your stay. And so, brief background, so you don't have to feel like you are telling your story a lot. A couple weeks ago, Carine she woke up, wasn't feeling good, her husband took her to work. When she got to work, passed out in the car. Husband called. He said, yeah, I'm driving Carine to work. I'm driving Carine to the hospital because she passed out. And, her blood pressure was really high this morning, but I don't know what's going on. And I'm like, passed out? What happened? And then Carine got on the phone, and all I heard, her speech was different. And she told me she couldn't move her right side, and her right side was numb. And at that moment, I knew that my friend was having a stroke. Called over to the hospital. I'm like, my name's Dr. Choa. My friend is en route with her husband. She's having signs of a stroke. Need you all to get ready for her to receive her. And the reason I do that, because I want them to be aware of what's coming, and then one, for you to get that life-saving medication, TPA, to reduce the disability, to be able to give you a chance, right? And so that's the reason I did it, because I'm like, she needs to get to the hospital. She needs TPA. So you go over to the hospital, tell Jack, they're going to take her. I'm briefing him. So they take you away, Carine. And at that moment, like, what are you thinking or experiencing? Like, what are your thoughts?
Well, at that moment, to be honest, I'm just praying to stay alive. I could definitely feel that something really bad was happening in my body. I could feel my brain getting foggier and foggier. That's the best way I can describe it. And I was feeling extremely, extremely weak, and scared for my life, scared for the outcome, understanding at that moment that I was having a stroke. I was pretty clear on that, based on my background as a physician. And I was just praying that someone will help me on time, Yeah.
And so they whisk you away. You go to CAT scanner. Jack goes back to you. I'm on speakerphone. I'm listening in on everything's going on. They're jotting down, doing something called the NIH score. They're testing your strength, all of this. And then this is actually, then after that, they whisk you away to a CAT scanner. And when you go to the CAT scan, I'm thinking, okay, they're going to mix this drug, this life-saving medication. They're going to give it in the CAT scanner, because I'm thinking about how I function, right, when I'm in the emergency department. They're going to give her this medication. She's going to go to the ICU, done, like no thoughts about it. So she comes back to the room. Then some guy comes in the room, and then he's doing his assessment now, and you know, asking more questions, questioning your speech. And then he did something which threw me for a loop. He asked you to walk.
Mhm. Yeah, yeah. He asked me to walk, and
Like Jesus on water.
and at that moment, to be honest, I did not think much of it. Like, I was really just, like I said, they could have asked me to walk on my hands. I would have tried because I just wanted help. I was noticing that there was a strong push for me to do more, and even when he was doing his assessment, there was an abrupt feeling to how he was proceeding and talking
Lift
to
up your
me.
hand, lift up
Yes,
your
and
hand, you know.
very borderline rude,
Mhm.
like, lift up your hand, lift up your hand, lift up your foot. And I'm like, you know I don't have the words to tell him that I'm trying my very best, because the articulation of my words it was difficult. Like, I could tell it was taking me more time to release the words that it would under normal circumstances, and I sounded weird, and that I couldn't. I knew I was in trouble, because when I would speak, it wasn't as fluent. It was as if, like, I was just impaired. And I was thinking to myself, and I kept telling them, like, my speech is changing, something is going on. I can't feel my right side. I don't have the strength. And I was just trying to contribute to the assessment, because I was hoping that the quicker I, was gonna get through this, the sooner I was gonna get the help that I needed, because they will have the full picture. Um, so when I was asked to get out of the bed and walk, um, the, even the link between my brain and my body, thinking that, yeah, this is a normal task that I can do, it did not occur to me that it may not be possible for me to walk, right? So I spontaneously agreed, and the first thing that was off to me is that, they had to get me off the bed. And when they did that, it started to sink that I really was weak, more than I anticipated. And they had to hold on to me. My husband then stood in front of me to be a shield. And I could hear, just take a step, take a step, take a step, very forcefully. And I was trying, and nothing was happening. And eventually, shame and embarrassment just, overpowered me. And I fell in my husband's arm and whispered in his ears that, like, I can't do it. I can't do it. And this is so embarrassing, with people that you work with, people that, see you from time to time, and the room was packed, all eyes on me. Um, it was a very challenging moment, and I when I think about it, it gives me chill.
Yeah. And I think for me, the biggest thing listening to him asking you to perform,
Mhm.
because to me, it felt that way,
That's
right?
how it felt. Yeah.
Yeah, I rush,
That's how it felt.
I work codes all the time in the emergency department. I have stroke patients, and a stroke patients, they come in, if they can't move their right leg or their right, or their right arm, and they can't speak, I'm not asking them to walk, to get up off the bed and test and challenge and walk, right? Because I know this is a time sensitive issue, right? And so if the symptoms, the signs align, right? If you have very obvious deficits, right? And the CAT scan looks normal, like, and we can push the medicine. There's no reason, or what we say, contraindication, to not push TPA, this life-saving drug. We do it, and we don't. I'm like, why? All this stuff is going on in the room. There's questioning. They're asking her to walk, and I'm just like, would this be different if somebody else came in? Like, that's the biggest thing, right? Just watching all of this happen was really troubling to me. And then I think you know, once finally you're going through, once, you know, you finally were like, okay, let's get this TPA. Oh, he eventually started talking about the medication.
Yeah.
And the one thing that I recall is he was like, you know, I think Jack asked, what are the risks and benefits of the medication? And he was like, well, the risks of the medication are bleeding. 1/3 of patients will bleed in their brain.
Mhm.
You know, 1/3 of patients improve. And then I think Jack asked, well, what happens to the rest of the third? Because you
Mhm.
talked about this third
Yeah.
and that third. And he's like, well, you know, most strokes will get better on their own, right? I think it
Mhm.
was something like
Yeah.
that. Like
Yeah.
most strokes will get better on their own,
And
right?
then he throw in there 1% die.
1%.
Um, yeah. And then um, what do you want to do now? Kind of, what do you want to do? Um, and I remember thinking, damn, my mind is so foggy. I'm so tired. Like, I can't make a decision on my own right now. Like, let me call my mother. And I was having an exchange between you, Jack, um,
And mom.
and mom. And my mom was asking very specific questions because she happens to have some background in neurosurgery. And I I could sense the energy just shifting, right? Once those questions started to fire, and this something just shifted. The atmosphere just shifted, and the focus on whether or not um I needed this treatment became it it became almost as if, like, this doesn't make sense. Almost like, this doesn't make sense. Something is missing, and we just have to do what we have to do, if you want us to do it, but this doesn't make sense.
And you know, sometimes we make decisions in medicine when things don't make sense. We do what we have to do, and then we think later, especially with life-saving interventions like,
Mhm.
you know, taking somebody to the cath lab when they're having a heart attack, right? You know, giving medications for a stroke. Sometimes we do what the treatment is, and we think about it later,
Mhm.
right? And then we can process, because we want to give that person the best chance of survival. We want to give that person the best chance of recovery. And so it was very disturbing to me to watch people processing something that was very straightforward: negative CT, TPA, ICU, monitor, physical therapy, occupational therapy, rehab if needed, period. Like a very simple bam, 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 bam. You got there within an hour of your symptoms. You should have had that medicine done, right? And so I think that was the biggest thing that was disturbing to me to watch. And
Mhm.
you know, these are your people, you know, and so that was hard.
Yeah.
Um, you know, and then they ended up pulling you and transferring you to the other hospital.
Mhm.
And when they transferred you to the other hospital, you know, what did the physician say?
So, the whole time I was there, there is something called neuro checks that they do in the ICU. But even prior to me being transferred to the ICU, I remember, and this is me having an exchange with my husband afterwards, thinking and sharing that, oh man, I feel like I did this exam like 10 times, like they kept on coming, and I was like, I don't know what you want me to say. Like, this is just the same. It's just me. Like, I don't know what else I can add to the story. I told you the story. Um, and I remember my husband telling me when we were debriefing later on that, what was really scary to him is when they asked me for the end time to smile, and my smile was crooked. And it was really scary to him. For some reason, that was the symptom that hit him, where my face was a little bit distorted. And I didn't know that. All I remember was that he kept asking me to smile. Like,
Mm.
everyone who would come would say, smile for me, stick your tongue out, smile for me. And there was part of me that was like, okay, this is part of neuro checks. And then there was a layer of me that was like, it's odd the way they asking me, almost as if they want me to
Catch you off guard.
perform. Like, and when the other hospital called in to have me pulled out because they were concerned about some findings on my brain imaging, the provider who was taking care of me, when I asked him why they were pulling me out, he was like, honestly, I'm not sure why they're questioning this brain scan. I think maybe it's poor in quality. I'm not sure. But the thing that I, I, I believe, you being a physician and your mom being a physician, that's the main reason why they're pulling you out, because basically they don't want trouble. And in that, and then he continued by adding to it, like, I don't want to say that you're lying or anything, but your exam, some of your findings on your exam were not necessarily consistent with the traditional picture of a stroke. And in that moment, I remember thinking to myself, like, so you think I just woke up this morning, left my house, I had nothing else to do, heading to work, and I decided, today's the day I'm just going to show up to the ER and act a fool,
And you have a 6-month-old.
And I have a 6-month-old at home, a 3-year-old,
A new business.
a new business. Like,
Yeah.
there were so many things that I was thinking and said to myself. It dawned upon me, having had the top conversations with you about advocacy and how we always need a strong advocate by our side when we go to the hospital. I felt really dismissed in that moment. Like, and he doubled down by saying, oh, it begs the question of conversion disorder.
Psychogenic causes.
So,
old enough to say it.
Yes. And by that time, my symptoms were improving after the medication. So my speech was fluent again, and he could compare and see how I was speaking to him at that moment versus when I came in. And I remember just asking him, like, so what do you make of the findings that you've had since I got here with my blood pressure and everything else that came up with labs and everything? And he didn't give me a straight answer, but he said, but the specialist at the other hospital will figure it out. That very moment, I will tell you that I felt really, really, really dismissed. Not only that, I felt ashamed. I felt ashamed. I felt really dismissed and ashamed, and I was like, I can't believe these are my own people.
You work with these folks.
And I kept wondering, if I had showed up in a different skin, a different gender, we were having this conversation, So when I got to the other hospital, you could tell the bias had been transferred in the report.
Bias, yeah.
In the report, but the team that came on was really eager to get to the bottom of it, and they weren't even. They were the initial person who got me, who actually made the decision to push, who really advocated for me to get the medication. To him, he had no questions about it. He was just like, this is not a question of whether or not you had a stroke. It's a question or not what happened. Why did it happen at 38? So that's not even what we're dwelling on right now. So I brought it up. I said, part of the possibilities that came up was that this was all psychiatric in my head and I'm losing my marbles maybe. And there's one specific provider who heard me and understood my concerns, and he had an honest moment with me, and he told me, he said, listen, if you were a 40-year-old white male in this situation, that conversation would have never taken place. And I just sat there quietly, I sat there quietly, sitting in the fact that, like, wow, I am living the bias in medicine that I advocate so strongly against. Um, and here we are.
Mama's on the call. You want me to join her? Let her in.
Mm-hmm.
I'm gonna let mommy in.
Oh, okay.
Your mom.
Yeah. Yeah.
Let me see if
So
she gets on.
so yeah.
There we go. Hi, mommy.
And
Hi, how you doing?
Good. We're having a therapy session.
Yeah, I'm listening.
yeah, yeah. So my mom was such a strong advocate for my care that I honestly feel like if I didn't have you guys in my corner, the outcome would have been very different. Very different. Mhm.
Yeah, I just, with all of this, I just think like with all the degrees, right? With all the work that you've done and the things that you do for your patients and your schooling and everything, and this still had to happen to you. Like it's just it's infuriating, right? As someone says, it's really scary because the way everything happened, you know, it could have gone completely different. And so it's just like, what are people going through out there who don't have
Yeah.
advocates, who don't have
What happens?
family members who are physicians, right? Like, what do people do? And as a community, like, what are we gonna do, right? And so I truly think that God gave you a story, and
Yeah.
you have to share that story, right? Number one, right? You are a miracle because some people, they didn't get to the hospital on time, right? They didn't get the medications. And they may not be able to talk, again. And so I think God gave you a testimony and a story, because you have to use your voice. You just have to continue to share your story and tell people, what you went through, so that you can help other women, other people, individuals, right? There's just so much work we need to do with the system.
Mhm.
So many layers to the story, like
Mhm.
so many layers. When you think back now and you revisit everything that happened in your brain, like, do you find yourself, do you feel like you're getting to a point where you're processing? Do you find that you're getting, because I feel like the more I think about it, sometimes I get a little angry.
That's what's happening right now. Like the more I think about it, the more I get angry. But I'm also caught in the process of like just focusing on the fact that like I have an opportunity to optimize my health and make sure that I'm around for the longest time for my children and my family, my husband, myself. But there's a layer of like humility in having the lens of a patient and understanding the barriers to care, the challenges, having to understand what advocacy means and how my story is literally an example of how bias can happen in medicine, even with all the background, even with the professional knowledge that I've had, that I have. And that to me is very humbling. And it reminds me that like the we have a long way to go. We have a long way to go, unfortunately. And I'm very grateful for all the support and people who rallied around me during this time, and all the even the resources to continue to optimize my health, having to go through PT and physical therapy, occupational therapy, speech therapy, and the fact that I'm able to sit here with you and I it's in itself it's very humbling. It's very humbling. I don't take it for granted one bit. Yeah.
Well, I wish you all the best kind of processing
Mhm.
this. And you know I think the hospitals definitely need that feedback, and so that they can treat people differently.
Mhm.
And
Mhm.
so, yeah,
And
continue.
I always say that even for me as a provider, like I'm always careful to quickly cast judgment on someone if I don't understand something. Because, for reason, and I'm going to refrain from sharing the outcome of what, came about and what we found out intentionally, but eventually it makes sense. What happened makes sense, right? But if we did not chase the rabbit all the way down the hole, I probably would have never known what really happened, because someone would have convinced me that
It was
it's all in here,
that you're making stuff up.
that I'm making stuff up. And that part to me is so dismissive, so belittling. And I say, we have to do better.
Yeah.
We have to do better. And I'm always very careful. If I don't understand something, I seek for support. I seek help. I seek support. I research. I look things up. I don't assume the person in front of me does not know what they're talking about or is making stuff up. You know.
Absolutely.
So
Well, I'm going to end our live, but I think this is just one of those, the beginning, right, of your story, Corinne. And if anybody has any questions, I want to ask you. She's tagged on. We're both on here. Just send us a inbox or DM. But happy to, talk further about your own experiences, because I know Karen's not the only one who's had these experiences with the healthcare system. So you guys may have your questions. So thank you for joining us on here today. And Corinne, thank you for sharing your story.
thank you. Thank you for allowing me to have this space to do so.
Yeah.